Hello, I'm Dr. James Wilson, and welcome to Senior Vitality Clinic. Today's topic is urgent and practical, heart warning signs you should never ignore after 60. This is not meant to scare you, it's meant to prepare you. When the heart or brain is in trouble, minutes matter. Fast action can save heart muscle, protect brain cells, and protect your independence. A lot of people picture a dramatic movie scene when they think of a heart emergency. They imagine someone clutching their chest and falling to the floor. Sometimes that happens, but in older adults, and in many women, the signs can be quieter. They can look like shortness of breath on a short walk. They can feel like unusual fatigue, a heavy feeling in the back or jaw, or nausea you can't explain. If you do not know these patterns, you might wait. Waiting is what causes damage. In this video, I'll walk you through the major warning signs of a heart attack, a stroke, heart failure, and abnormal rhythms like atrial fibrillation. I'll explain what to do right now if any of these happen. I'll help you set up a plan so you and your family know the first step before a crisis ever begins. You'll also learn when a blood pressure reading means emergency and when it means call your doctor today. I will keep the language clear. I will keep the steps simple. And I will point you to reliable sources so you can read more with your family and your own healthcare team. Remember, this is education, not personal medical advice. Bodies differ. Medicines differ. Your plan should be made with your doctor. If you remember one thing, let it be this. New, sudden, or worsening symptoms deserve prompt care. For severe symptoms, call 911. Heart and brain problems become more common as we age. That's not a reason to panic, it's a reason to have a clear plan. After 60, symptoms often look different than the classic picture. A heart attack may not feel like crushing chest pain. It might be breathlessness after a short walk, a new sweat that soaks your shirt, nausea that won't pass, or a band-like pressure in the upper back. Women, in particular, may notice patterns that are not obvious, including jaw pain, arm discomfort, unusual tiredness, or shortness of breath without strong chest pain. These patterns are described by the Centers for Disease Control and Prevention and Mayo Clinic, and they are easy to miss if you expect only one kind of symptom. Knowing the range of signs helps you act fast. It also helps to understand a basic difference that confuses many people: heart attack versus cardiac arrest. A heart attack is a blocked artery. The heart muscle is starved of blood. The person is usually awake and breathing. This needs urgent treatment, but does not always cause collapse. Cardiac arrest is when the heart stops pumping effectively. The person collapses and is unresponsive. That is when CPR and an AED can make the difference while help arrives. If someone collapses and is not breathing normally, call 911, start chest compressions, and use an AED if one is available. Knowing this difference helps you choose the right action without losing time. There is another reason symptoms get missed after 60. Many older adults live with other health issues. Diabetes can dull pain. Arthritis can mask chest pressure by creating other aches. Reflux can cause chest burning that seems similar to heart pain. Shortness of breath can be blamed on getting older or being out of shape. Medications can change how symptoms feel or hide early clues. That is why I ask my patients to build a personal plan with their own doctor. Ask, if I feel chest pressure or breathless climbing stairs, what is my first step? Ask for a written plan. Put it on the fridge and near your phone. Share it with your spouse, adult child, or neighbor. This kind of plan lowers panic and speeds up care when seconds count. Finally, please do not drive yourself to the hospital during a suspected heart attack or stroke. We say this over and over because it matters. Paramedics can begin treatment on the way and alert the hospital before you arrive. That can save precious minutes that protect heart muscle and brain tissue. If your symptoms are sudden or severe, especially chest pressure, trouble speaking, weakness on one side, or severe breathlessness, call 911. Let's start with the signs of a heart attack. The most common pattern still matters: chest discomfort that can feel like pressure, tightness, squeezing, or fullness. It may sit in the center or left side of the chest. It can spread to the arm, shoulder, neck, jaw, back, or upper stomach. You might have shortness of breath, cold sweat, nausea, or lightheadedness. Sometimes the discomfort is mild. Sometimes it comes and goes. Sometimes it builds slowly. Any new or worsening version of these symptoms deserves attention. If the symptoms are severe or feel unsafe, call 911 right now. Sit down. Stay still. Keep your phone nearby. If a 911 operator or your clinician has told you to do so, you may be instructed to chew aspirin unless you are allergic or have been told to avoid it. Keep your medication list within reach so responders can see it the moment they walk in. The CDC's public guidance lists these symptoms and stresses the need to call 911. Now let's address what often gets missed, especially in older adults and women. You may not feel strong chest pain at all. You might feel unusual fatigue that stops you mid-task. You might pause halfway through the mailbox run because of breathlessness you did not have last month. You might notice a band of pressure in the upper back, discomfort in the jaw, or a heavy ache in one or both arms. You might feel nauseated and write it off as something I ate. These quieter signs still point to the heart, and Mayo Clinic and the CDC both note that these patterns are common, especially for women. If you see yourself in this description, talk to your doctor about your risk and your plan. If the symptoms are sudden or severe, call 911. Do not wait for the classic movie symptom to appear. You may also hear the word angina. Angina is chest discomfort from reduced blood flow to the heart, often brought on by activity and eased by rest. It can be a warning sign days or weeks before a heart attack. If you have repeated episodes of pressure with exertion that ease when you stop, call your doctor. Do not try to work through it. The right tests, medications, or procedures can lower your risk and protect you from a crisis later. Mr. R is 72. He walks his dog every morning. For months, the loop took him 10 minutes and barely raised his pulse. Over the last week, he needed to pause halfway to catch his breath. He also noticed a sweat on cool mornings and a dull ache across his upper back. He blamed poor sleep. On day 7, the ache spread into his left arm. His spouse called 911. Paramedics saw changes on the ECG and activated the hospital team. He received fast treatment for a blocked artery and went home a few days later. The mild breathlessness and backache were the early signs. Knowing that these signs count saved time. If you have risk factors, high blood pressure, high cholesterol, diabetes, smoking history, a strong family history, ask your doctor about your specific risk and a clear action plan. Ask what to do first if you feel chest pressure, breathlessness, or unusual fatigue. Ask whether you should carry aspirin and whether you should use it in an emergency. Write the plan down and tell your family where it lives. A stroke happens when blood flow to part of the brain is blocked, or a blood vessel bursts. The brain is very sensitive to changes in blood flow. That is why fast action saves function. The CDC teaches the FAST method. F stands for face. One side of the face may droop when smiling. A stands for arm. One arm may drift down when both arms are raised. S stands for speech. Speech may be slurred or hard to understand. T stands for time to call 911. Do not wait to see if it passes. Even if the symptoms clear in minutes, that can be a TIA, a warning stroke, that still demands urgent care. Other stroke signs include sudden trouble seeing, sudden confusion, trouble walking, dizziness, loss of balance, and a sudden severe headache with no clear cause. Write down the time the symptoms start. That helps the hospital team decide on the best treatment. Phys E is 68. While talking on the phone with her daughter, she noticed her words became jumbled and the phone felt heavy in her right hand. Her daughter heard the change in her voice and told her to smile. Only the left side lifted. They called 911 right away. At the hospital, the team acted fast. Because her daughter knew the exact time her speech changed, the team could make a quick decision about treatment. She recovered well and was home within days. The difference came from fast recognition and fast action. What to do now? If you have atrial fibrillation, high blood pressure, diabetes, high cholesterol, or you smoke, talk to your doctor about your personal stroke risk. Make sure your blood pressure plan is clear. If you have AFib, ask whether you need blood thinners to lower stroke risk. If you snore or gasp at night, ask about sleep apnea, which can raise blood pressure and strain the heart. Heart failure warning signs. Heart failure does not mean the heart has quit. It means the heart does not pump as well as it should. When the pump is weak or stiff, fluid can build up in the lungs and legs. People notice shortness of breath, swelling in the feet, ankles, legs, or belly, and a rapid weight gain over a day or a week. Many programs teach a simple habit. Weigh yourself every morning, after using the bathroom, before breakfast, wearing similar clothes, and write it down. If the number jumps, for many people 2 to 3 pounds in a day or 5 pounds in a week, call your doctor. That jump can mean fluid is building up. Adjusting medicines early can prevent an ER visit. The American Heart Association teaches this daily weight rule and encourages people to know their personal weight change threshold. People with heart failure may also notice a night cough, waking short of breath, needing extra pillows to sleep, fatigue, or poor appetite. The signs can be slow and easy to miss. That is why logs help. Keep a simple notebook with your morning weight and your daily symptoms. If your shortness of breath is severe, if you cannot speak in full sentences, or if you feel chest pain, call 911. If symptoms are new or worsening but not severe, call your doctor the same day so changes can be made before a crisis. The AHA materials also note that both sudden weight gain and fluid retention are key signals to act on. Fitzgerald is 76 and has known heart failure. He keeps a paper on his fridge where he logs his weight and how he feels. Over 4 days, his weight rose by 4 pounds, and his socks left deep marks around his ankles by evening. He felt more winded going to the mailbox. He called his clinic before lunch, and his nurse adjusted his plan. By the weekend, his weight was back to baseline, and his breathing felt normal. He avoided a hospital stay because he noticed the early signs and called the same day. What to do now? If you have heart failure, ask your team to write out your personal target weight, your salt-sodium limit, your fluid limit if you have one, and the exact weight changes that mean, call us now. Put that plan with your medication list and keep a copy in your wallet. Ask about vaccines that lower risk of infections that can stress the heart. Make a simple daily routine that includes a short walk, balance practice, and a set time for your medicines. If you are unsure how much activity is safe, ask for a cardiac rehab or home program that fits your current level. Always talk to your doctor before changing your plan. Atrial fibrillation, often called AFib, is a common rhythm problem after 60. The top chambers of the heart quiver instead of squeezing in a steady way. Blood can pool and form clots, which raises the risk of a stroke. Some people feel fluttering, a racing or irregular heartbeat, shortness of breath, fatigue, or lightheadedness. Some feel nothing. Because AFib can be silent, you might not know you have it until a checkup finds it. Medline Plus explains that AFib raises stroke risk and needs proper treatment. The National Institute on Aging notes that occasional extra beats can happen with age, but frequent fluttering or racing can mean a rhythm problem that needs attention. If you have sudden chest pain, fainting, or severe shortness of breath, call 911. If you have new palpitations, a rapid or irregular pulse, or you feel unwell in a way that is new to you, call your doctor. They may order an ECG or a longer monitor to catch the rhythm over days or weeks. If AFib is confirmed, ask whether you need stroke prevention medicine. Not everyone needs the same plan, so this is where talk to your doctor truly matters. The right treatment lowers stroke risk and helps you feel better day to day. Case vignette, education only. Mrs. S is 74. She felt fine most days, but once or twice a week, noticed a flutter in her chest when she sat down after dinner. It faded in minutes. She mentioned it at a routine visit. Her doctor ordered a 2-week monitor. It caught several episodes of AFib. After a careful talk about risks and benefits, she started a stroke prevention plan. 6 months later, she felt steadier and less anxious because she knew what the flutter meant and what to do. What to do now? Check your pulse once in a while when you feel relaxed. If it feels very fast, very slow, irregular, or you feel weak or dizzy, write down what you felt and when it happened. Share that with your doctor. If symptoms are severe or you feel unsafe, call 911. If symptoms are new but modest, call your clinic promptly to arrange testing. When blood pressure becomes an emergency. Let's be clear about blood pressure. Everyone's numbers change during the day. A single high reading after a stressful moment does not always mean emergency. But there is a level where action is urgent. If your blood pressure is 180 over 120 or higher, and you have chest pain, shortness of breath, back pain, numbness, weakness, vision change, or trouble speaking, this can be a hypertensive emergency. Call 911. Do not wait to see if it will drift down. The American Heart Association states this clearly. If your reading is 180 over 120 or higher without symptoms, sit quietly, repeat it in 5 minutes, and if it stays high, call your doctor the same day for guidance. Mayo Clinic offers similar advice. Make sure you know your personal target range and which home cuff is right for you. Mr. K is 69 and checks his blood pressure in the morning. One day the number was 186 over 122, and he had a dull headache and a brief blur in his right eye. He repeated the reading after 5 minutes of quiet. It was 184 out of 120, he told his wife, and they called 911. At the hospital, he was treated and observed. His plan was adjusted, and he learned how to set a calmer routine before his daily reading. He now knows the exact numbers that mean call today and the symptoms that mean call 911. What to do now? If you own a cuff, bring it to your next visit. Compare your home reading with the clinic's reading to confirm accuracy. Ask your doctor for a written home BP plan. What time to check, how to sit, which numbers are okay for you, which numbers mean call today, and which numbers plus symptoms mean emergency. Keep that plan with your medication list. Pulling the signs together. It helps to gather the warning signs into one picture you can hold in your mind. Heart attack signs are not always loud. They may be a heavy pressure, shortness of breath, sweat, nausea, or a spreading ache to the jaw, back, or arms. Stroke signs are quick to spot if you remember FAST, face, arm, speech, time to call. Heart failure often shows up slowly, with swelling and a jump on the bathroom scale. Rhythm problems may be fluttering, racing, a skipped feeling, or they may be silent and found only on a monitor. Blood pressure emergencies are about very high numbers plus danger signs. If you're not sure whether what you feel is urgent, here is a simple rule: sudden, severe, or new in a worrying way. Call 911. If symptoms are new but tolerable, call your doctor the same day and explain what is different. Your body is the expert on your baseline. You know when something feels off. Please listen to that signal. Let's turn this into a plan you can set up in one afternoon. Build a one-page medical summary. At the top, list your name, date of birth, allergies, and emergency contacts. List your current conditions, past surgeries, and any devices such as stents or a pacemaker. List each medicine, dose, time of day, and the reason you take it. Add your doctor's and pharmacist's phone numbers. Print 2 copies. Put one on the fridge and the other in your wallet. Take a photo on your phone so you can share it easily. Make a first step card. This is a small index card with your personal red flags. For example, chest pressure, new severe shortness of breath, heavy back or jaw pain, face droop, arm weakness, slurred speech, fainting or BP 180 over 120 with symptoms equals call 911. Add, if told by doctor or 911 to do so and not allergic, chew aspirin. Add, unlock door, sit down, keep phone on speaker, keep medication list ready. Tape a copy inside your front door. Put one in your wallet. Talk with your doctor about your risks. Ask, what are my biggest heart risks? Ask, if I feel these symptoms, what is my first action? Ask, do I need a home blood pressure cuff? Which model? What numbers are okay for me? Ask, should I be screened for AFib? If you have heart failure, ask for a written plan. What weight change should prompt a call? What is my daily sodium limit? Do I need a fluid limit? Write the answers down and keep them with your summary. Set up home routines that protect you. Take medicines exactly as prescribed. Use a pill organizer and a calendar or phone reminder. If your team has advised a lower sodium plan, pick 3 high-salt foods you eat often and swap them for lower salt choices. If you have heart failure, weigh yourself first thing every morning and log the number. For movement, do what your doctor has cleared. Daily walks, gentle strength work, and a bit of balance practice. Keep sleep regular. If you snore, gasp, or wake unrefreshed, ask about sleep apnea. If you smoke, ask for help to quit. There are proven methods that make it easier. Practice the phone call. It sounds simple, but it helps. Say out loud, "My name is Nayi Wout. I'm calling because I have sudden chest pressure and shortness of breath." Or, "I'm with my spouse. Her face is drooping on one side and her speech is not clear." It started at 10:12. Being ready to say those words reduces panic. Teach your circle. Share your one-page summary with a spouse, an adult child, or a neighbor you trust. Tell them where you keep your medication list. Ask them to learn FAST for stroke. Ask them to call 911 if you seem confused or cannot find words. Rehearse what to do if you collapse. Call 911, start compressions, grab the AED if the building has one. Caregivers, keep a small notebook. Jot down new symptoms, times, and what was happening when they started. Bring that history to visits. It helps the team see patterns and adjust plans. Let's recap the main points so you can carry them with you. After 60, heart and brain problems become more common, but knowledge and a simple plan make all the difference. Heart attacks are not always loud. They can be pressure, breathlessness, sweat, nausea, or a heavy ache in the jaw, back, or arms. Do not wait for the movie version. If symptoms are severe or feel unsafe, call 911. The CDC lists these signs and tells us to call right away. Strokes are clearer if you think FAST, face droop, arm weakness, speech trouble, time to call 911. Note the time symptoms started. That timestamp helps the hospital team pick the best treatment. The CDC teaches this method across the country. Heart failure often speaks through your bathroom scale and your socks. Swelling, breathlessness, and a quick weight jump mean call your doctor the same day. Severe breathlessness or chest pain mean call 911. The AHA recommends daily weights and clear thresholds for when to call. Atrial fibrillation raises stroke risk. Some people feel fluttering or racing, some feel tired, some feel nothing. If you notice palpitations or an irregular pulse, or if you just feel off, talk to your doctor about checking your rhythm and whether you need stroke prevention medicine. Medline Plus and the NIA both discuss these patterns and why follow-through matters. Finally, a blood pressure of 180 over 120 or higher with danger signs like chest pain, shortness of breath, vision changes, weakness, or trouble speaking means emergency. Call 911. The AHA and Mayo Clinic are clear about this threshold and the need for immediate help. Please remember, this video is education. It does not replace your doctor. Your body and your history are unique. Talk to your doctor about your risk and your step-by-step plan. If this helped you, please subscribe to Senior Vitality Clinic, share it with someone you love, and leave a comment about what you want covered next. Your knowledge today could protect a life. I'm Dr. James Wilson. Stay ready, stay steady. I'll see you in the next video.